name is Charlotte, and I'm Dee's mom, and I am caregiving in the key of D. Today's video will be about advanced directives. We will be talking with Dr. Austin Dalgo with Methodist, Hospice, and Palliative Care.
Hey, Miss Charlotte and Mr. Fidel, I want to talk to you guys about this form. It's called a POST form, and POST stands for Physician Order for Scope of Treatment. Every state, just like Tennessee, has a POST form for families and patients to be able to sign and make sure that their wishes are known. This form is just one page, thankfully. Some states have 20-page forms, but thankfully our state only has one page. And really there's about 4 or 5 different sections. The first top section is just telling us who the patient is and what their date of birth is. The next section is section A, and section A is really about the heart. It tells you, it asks you actually, do you want chest compressions, shocking or defibrillation, or cardiac medications to restart the heart? And really the answer that people have is no, I don't want that, or yes, I do want that. So that's section 1, the heart. Section 2 is about the lungs, and it tells you sort of what respiratory interventions you might want. The first box here, called comfort measures, just is basically only give me respiratory treatments if it helps me feel more comfortable. I don't want ones that prolong my life. The middle one is I want all the respiratory interventions that might prolong my life up to intubation. I don't want intubation. Intubation just means putting the tube down your throat, connecting you to the breathing machine, and really what people call life support. And then full treatment, the last box, tells you, yeah, I want everything. I want the intubation. I want all the other respiratory interventions. So that's box 2, or section 2. And then section 3 is about nutrition. And so really the question is, I don't want any nutrition or IV fluids, or yes, I do want it, or I want long-term nutrition, which would be like a G-tube. Okay. And so those are your 3 options there. And then the second to last section is who is it that I'm talking to? And we check those boxes for parents or surrogates, or if I'm talking to the patient themselves. And then the other side is really why are we making this decision, based on preferences or best interests or whatever it is. And then finally the last section is who's signing it, and making sure that, first of all, you have to have the doctors or the nurses or the nurse practitioners or the certified nursing assistant signature. The parents don't actually have to sign it, but I like to get the parents to sign it because it tells the EMS people that I'm not some rogue doctor going around signing do not resuscitate orders on patients, but that I've had this conversation with you guys and made sure that these are your wishes.
Okay. So would this form have to be filed with an attorney, or is it just something that you can do at the hospital?
That's a good question. You can just do it here at the hospital. You don't have to have an attorney. You don't have to have it notarized. You don't have to have any of that stuff. And the important thing about this form is that the only way that the ambulance services, the EMS, know what your wishes are is for you to fill this form out. If they don't see this form, then they have to do the full treatment. So even if your wishes were do not resuscitate, don't do chest compressions, and you didn't have this form, they would have to do full resuscitation. Okay. So this is your one way to tell people, these are my wishes, and this is a legally binding document. And if your wishes ever change, you can throw it in what I call the round file, which is the trash can. You can rip it up, and you can call us back, and you can say, no, my wishes have changed, I want something different. Okay. And so this doesn't mean it's set in stone, but this does mean that they have to honor your wishes.
Well, thank you for letting us know this. I'm sure plenty of our parents out there that has special needs kids will like to be more aware of this form that's out there. Most people are not aware of their choices or their rights. So thank you again.
Yeah, absolutely. Thank you guys.
All right.
Hello, my name is Justin, and I'm Dee's little brother. Please like, share, and subscribe. Comment down below your questions and your favorite part. We are caregiving in the key of D.